Hello, my name is Charmaine Bradford, and this presentation is titled Kyle, a Case Study of Conduct Disorder. Let me tell you a little bit about Kyle. He's had quite a life so far, and he's only 12 years old, but meet Kyle. He is angry, aggressive, pugnacious, disruptive, combative, defiant, often truant from school, manipulative, unremorseful, forgetful, erratic, irritable, disorganized, impulsive, fidgety, and considers himself blameless for practically everything. Phew, that's enough to make a person tired. And to make things worse, his real dad is in prison for drug possession. He has a stepdad and two younger half-siblings. His mother has to work part-time. Both grandfathers are alcoholics, and it's been going on for a long time. Oh, it's a great life. But there are some good things about Kyle, too. On the positive side, he doesn't set fires. He's not cruel to animals. He has never run away from home. He denies psychotic symptoms. He denies suicidal or homicidal ideation. He also denies depression, has no obvious cognitive deficits, and has no apparent comorbid illnesses. Oh, thank heavens, we can work with this kid. Even though Kyle declines a diagnostic exam, through observation and summation of his prior and current history and according to the DSM-5, Kyle should be diagnosed with conduct disorder with the specifier with limited prosocial emotions and the previously diagnosed comorbid attention deficit hyperactivity disorder. When Kyle is in a more agreeable mood, we can perform some differential diagnostics testing to rule out possible medical causes for his out-of-control behavior. As soon as possible, we will run routine lab tests, a thyroid panel, and perform a Conners Comprehensive Behavior Rating Scale diagnostic screen to verify the ADHD diagnosis. We may consider a personality inventory for children, PIC2, at a later date as well to support the diagnosis of conduct disorder. In the meantime, we can rule out an oppositional defiant disorder because of the severity, frequency, and persistence of symptoms. We can rule out bipolar disorder because of its similar persistence rather than episodic and early onset. We can also rule out intermittent explosive disorder because of the premeditated appearance of the misbehaviors and a lack of remorse. There is one additional area of concern involving Kyle's statement, "So what are you going to do, shoot me?" in response to one of his teacher's comments. This may be indicative of an underlying depressive disorder and should be investigated as soon as possible as well. However, before treatment can even begin, clear, reasonable, reachable goals must be set. There will be long-term goals and short-term goals. The long-term goals we may consider can be to reduce intensity and frequency of hostile and defiant behavior toward adults, to terminate temper tantrums and replace them with calm, respectful compliance with adult directions, to begin to consistently interact with adults in a mutually respectful manner. Also, to resolve conflict that underlies anger, hostility, and defiance, to bring hostile, defiant behavior within socially acceptable standards, and to reach a level of reduced tension, increased satisfaction, and improved communication between Kyle and his family. Now, immediate and short-term objectives with working with Kyle will be to develop a working relationship with Kyle so he can openly share his thoughts and feelings, to decrease the frequency and intensity of hostile, negativistic, and defiant interactions with adults, to identify how Kyle would like to be treated by his mom and stepdad and other adults, to develop Kyle's ability to verbalize the connection between feelings and behavior, to increase Kyle's ability to identify and appropriately verbalize what he needs from his mom and stepdad and other adults, to increase the frequency of Kyle's civil, respectful interactions between him and his parents and other adults, to have Kyle show verbal recognition of what is acceptable and unacceptable behavior in the family and the consequences of being exiled unless the behavior is kept within the agreed upon limits. Also, to have Kyle and his mom and stepdad reinforce each other positively and ignore inappropriate behaviors from both Kyle and the adults. To have the parents develop clear boundaries and behavioral expectations for Kyle and implement specific doable consequences when they are violated, as well as appropriate rewards when they are respected. To have Kyle's mom and stepdad provide corrective social interaction for Kyle. It should be noted that this objective may be very difficult, as the parents may have few to no social skills themselves and may need a few lessons along the way. And lastly, to have Kyle and his family comply by implementing the strategic, structural, and other directives as prescribed in the program. Well, now that the goals and objectives have been decided upon, therapy can begin. And as the saying goes, you have to start somewhere if you want to get anywhere. So, therapeutic interventions will be a process program designed to teach Kyle and his family members how to implement and maintain the goals listed above. Interventions will include facilitating a family session in which the family is shown as they are, then process the experience with the family, and then create a scene of what they would like to be. Explore with Kyle his hostile, defiant, and negative behaviors, and then reframe each one of them into a positive behavior. In family sessions, address issues of respect, cooperation, and conflict resolution to discover possible solutions which are reached and tested. We should also work with Kyle to become able to recognize his feelings and teach him how to express them in constructive, respectful ways. We need to teach Kyle's mom and stepdad new reinforcement techniques, giving feedback and suggesting adjustments as needed. And when they are ready, have a family session, giving the family a task or problem to solve together in a collaborative way. Throughout, we should redirect them as necessary, and then process the experience with them. We need to assist his mom and stepdad in defining acceptable and unacceptable behaviors for Kyle and in developing timeouts to reinforce these limits. We need to teach his mom and stepdad how to ignore abusive, negative behaviors and use positive and negative reinforcement techniques. We need to help his mom and dad develop and implement a behavior modification contract with Kyle with rewards of money or special privileges. We should videotape a family session using appropriate parts to show the destructive family interaction patterns. Then we want to show them more appropriate, respectful behavior patterns for both adults and children. We should discover causes of feelings of defiance and help Kyle make the connections between feelings and behaviors. And then we should teach Kyle about the basics of treating others respectfully. Practice with him and ask him to treat everyone with respect for 1 week. And during that 1 week, monitor him and discuss then the results of the experiment. As a result of the intensity of Kyle's behaviors, interventional pharmacological additions are indicated. Medications will be titrated and or changed as time and progression in therapy proceed. The medications will initially include methylphenidate for both the conduct disorder and the ADHD, and risperidone for the aggressive behaviors. Another medication that may be instituted if it is determined Kyle also has comorbid depression will be Lexapro, which is indicated for children 12 and older for major depressive disorders. It must be remembered that this therapy program takes time, lots of time, effort, patience, and lots of consistency with both Kyle and his mom and stepdad. So even when discouragement happens, as it usually does, giving up is not an option. Improvements may take weeks, but if the program is followed reasonably well, over a period of months, improvements will begin to appear, and lives will change for the better. Thank you very much.